1.71 billion people. It's quite a number, isn't it? That's the estimate worldwide for people affected by musculoskeletal conditions.
Staggering.
It really is. And it puts this, well, immense strain on healthcare systems everywhere, leads to those long waiting lists we hear about for planned procedures and, ultimately hits patient quality of life. It's a massive challenge for orthopedics, no question.
A huge challenge.
Welcome to the Deep Dive. This is where we take a stack of research, articles, reports, basically, whatever sources you bring to us, and we try to distill the really important knowledge, maybe some surprising insights too.
Cut through the noise.
Exactly. Get you the essential takeaways. And today, we are doing a deep dive into how digital technology and specifically artificial intelligence are looking to transform orthopedic care. We're focusing on planned procedures.
Yes, a really fast-moving area.
And guiding us through the material we've pulled together for this particular dive is our expert, someone who's brilliant at synthesizing these sometimes quite complex topics and helping us understand what really matters. Welcome.
Thank you. It's great to jump into these sources. We've looked at quite a mix, actually. Some detailed research papers on specific AI uses.
Right.
Broader reviews on digitalization's impact, and even some thinking from, outside healthcare on things like data and user engagement.
Yeah, it's a rich set of sources, gives us different perspectives. So our mission for this deep dive, really understand how AI and these other digital tools are actually influencing planned orthopedic care, starting right from assessment and planning, all the way through the surgery itself and into recovery.
The whole pathway.
The whole pathway. So let's kick off with a quick rapid-fire round just to sort of get our bearings. First question for you. Looking at these sources, what's the single biggest problem in orthopedics right now that digital tech is really trying to solve?
Well, the fundamental issue, it seems, that keeps coming up is just managing the sheer volume of patients and consequently easing the burden on healthcare systems.
Just the numbers.
Exactly. Musculoskeletal conditions are a leading cause of disability globally, demands rising, especially with aging populations. So digital tools offer potential ways to handle that scale more efficiently.
Okay, that makes sense. Second question, where are we seeing the most practical sort of in-use promise from AI in orthopedic practice today? What's actually happening now?
Right now, I'd say the most concrete applications seem to be in analyzing imaging, helping process x-rays, that kind of thing, and definitely assisting with preoperative planning and also predicting patient outcomes.
Okay.
That's where we are seeing some validated tools starting to emerge.
Got it. And third question, what's the biggest hurdle, the main sticking point preventing widespread adoption of these technologies across orthopedics?
Across the board, a really critical challenge is data integration. Just getting different systems, different types of patient information to talk to each other effectively.
Right, the plumbing.
Pretty much. And linked very closely to that is the need for really robust validation of the tools themselves, building trust, both clinician and patient trust, and crucially, navigating the pretty complex ethical landscape around AI in healthcare.
That frames it perfectly. Challenge and opportunity. Okay, let's really unpack this. Let's start at the beginning of that patient journey. Diagnosis and planning. You mentioned the massive patient volume. Can AI actually help right at that initial assessment stage?
Well, that's certainly the hope, and it's an area where research is very active. We are seeing applications of AI, machine learning, deep learning being used to analyze orthopedic images like x-rays. Some studies mentioned in the sources suggest AI models can perform well comparably to, or sometimes in specific tasks, maybe even outperform clinicians or radiologists.
Really? Outperform? In what sort of tasks?
Things like detecting certain types of fractures or identifying and staging how severe osteoarthritis is on a standard 2D X-ray. Deep learning, DL, it's a type of machine learning. It's particularly good with large amounts of image data.
That sounds like it could really speed things up at the front end. Are there specific examples in the sources of this kind of AI analysis being used?
Yes, yeah. One source mentions a deep neural network, a DNN, which is just another term for a deep learning model that Lim and colleagues developed specifically for osteoarthritis screening.
Okay.
Another study by Ratzlaff used web-based questionnaires combined with some AI analysis for initial OA detection. The idea is tools that could potentially screen patients earlier or maybe help generate a list of possible diagnoses to investigate.
Okay, but is that really ready for prime time, though? Can AI actually diagnose someone just from, say, an image or a questionnaire remotely?
Well, this is where the sources give us a bit of a a reality check.
Right.
Because while these screening tools might show high sensitivity, they're good at flagging potential issues, so they don't miss things.
So they catch a lot.
They catch a lot, yeah, but their specificity can be quite low. For instance, that JMR review highlights a knee OA web questionnaire with 73% sensitivity.
It sounds good.
But it also notes symptom checker specificity could be as low as, say, 23% to 27% in one study they looked at.
Ah, okay. So high sensitivity, low specificity means.
You get a lot of false positives. You flag lots of people who don't actually have the condition.
Right. So it might send perfectly healthy people down the pathway for more checks.
Precisely. And that JMI review is pretty clear. Despite these developments, there's actually limited evidence that current standalone digital health apps can reliably establish a primary diagnosis remotely, especially when you compare them to traditional clinical methods.
Like seeing a doctor face-to-face or having a specialist review detailed scans.
Exactly.
And why is that limitation so significant? What are these digital tools missing compared to, say, a clinic visit?
Well, they often lack the integration of crucial clinical data. I mean, a doctor gathers information from a physical exam, right? They interpret imaging, but in the full context of the patient's history, maybe order lab tests.
The whole picture.
The whole picture. Current remote apps often operate in silos, maybe just using one or two data streams.
Yeah.
Plus, as the Psychot2J review points out, there's often a mismatch between how bad arthritis looks on an X-ray and the patient's actual symptoms.
Oh, right. You can have a bad X-ray but feel okay, or vice versa.
Exactly. So an AI relying only on image severity could easily miss or misinterpret that clinical nuance.
So, okay. While AI offers, let's say, tantalizing potential for initial sifting or providing some info, it's definitely not replacing the full diagnostic process yet. It needs more data input, more context.
Precisely. Based on these sources, the current clinical utility for standalone remote diagnosis seems quite limited.
Okay, that's clear. Let's move a bit further into those early stages then, specifically pre-operative planning. How's AI being used there to help surgeons get ready for a procedure?
Now, this is an area showing, I think, stronger practical application today. AI is being integrated into software that really helps with surgical preparation.
Oh.
Things like helping optimize implant design. There's mention of a machine learning application for hip stem design, for instance, or facilitating patient-specific adjustments, creating really detailed 3D templates based on the patient's imaging data.
So tailoring the plan to the individual.
Exactly. One study used deep learning to identify the best anatomical landmarks for a total knee replacement, helping surgeons plan their cuts and implant placement more accurately. And we're also seeing AI used on post-operative images to predict future risks. There's a fascinating example of the sources about using a convolutional neural network, a CNN, which is great for image analysis.
Okay.
That achieved 89% sensitivity in classifying total hip replacement patients for their risk of dislocation, just based on a single post-op X-ray.
Wow, 89%. That's very specific. What's the actual practical value of predicting dislocation risk like that from an X-ray?
Well, if you can reliably identify patients predicted to be low risk, you could potentially tailor their post-operative protocols.
So not everyone needs the same strict rules afterwards.
Potentially, yes. Instead of a one-size-fits-all approach, maybe lower-risk patients could have fewer movement restrictions. That might lead to faster or perhaps less burdensome recoveries, while, of course, making sure the high-risk patients get all the necessary precautions.
Right. It's about personalizing that post-op care using data to assess risk.
Exactly. Data-informed risk assessment.
So from refining the actual implants to patient-specific 3D planning and even predicting post-op risks during planning, AI seems to be really pushing towards making surgical strategies more precise and personalized.
I think that's a fair summary, yes.
Okay, let's shift gears a bit now. Moving beyond the planning phase into the actual treatment and then the post-operative journey, what role are AI and other digital tools playing there?
Well, this is where we see AI really heavily involved in predictive analytics, predicting patient outcomes, predicting risks. The sources detail quite a few models being developed and tested for specific complications or maybe resource needs.
Like what kind of things?
For instance, predicting the need for blood transfusions after a total knee replacement. That's discussed, with one machine learning model achieving an AUC of 0.88.
AUC, area under the curve. That's a measure of accuracy, right?
Yes, essentially how well the model distinguishes between groups, in this case, patients who will need a transfusion versus those who won't. 0.88 is considered pretty good performance.
And these predictive models, they're also being used for sort of operational efficiency too, like predicting how long someone might stay in hospital or if they might be readmitted?
Oh, absolutely. Predicting length of stay after procedures like total hip replacement is a key area. Same for predicting unplanned readmissions.
Right.
And these predictions aren't just useful clinically. The BOA source specifically highlights how predictive analytics can really help improve hospital efficiency and resource management. Forecasting demand, managing patient flow
It
better.
makes sense.
They even mentioned studies showing high accuracy for predicting things like how long a specific surgical case might take. And this predictive capability also extends to quite serious complications. Things like predicting periprosthetic joint infection PJI or surgical site infections after knee replacements. That allows for more targeted prevention efforts in those identified as high risk.
Okay, predicting objective clinical outcomes like infection or length of stay, that makes intuitive sense. But some sources mention predicting patient satisfaction. That seems, well, much harder to pin down and predict.
It is definitely complex, and the sources acknowledge that even with technically successful surgery, a significant chunk of patients, maybe 20%, sometimes even 30%, report they haven't really improved, or they're actually dissatisfied after a joint replacement.
Wow, that high.
It can be, yes. What's interesting is that machine learning models are being developed to try and predict this dissatisfaction. And often, factors like the patient's preoperative functional level and their mental health status emerge as really key influencers.
So it's not just about the surgery itself.
Not entirely, no. It highlights that satisfaction is multifaceted. One study mentioned used a multimodal model, pulling in various data points, and achieved an AUC of 0.816 in predicting dissatisfaction.
But thinking about the data used for these complex predictions, can we really rely heavily on things like patient-reported outcome measures, PROMs? Are they robust enough on their own?
That's a really important point, and the sources do caution against relying solely on PROMs for prediction. They can suffer from what's called a ceiling effect,
Meaning?
meaning patients who already have relatively high function before surgery might not show a large measured improvement on a PROM score afterwards, even if they personally feel the surgery was a huge success for them.
Ah, I see. The scale doesn't capture their perceived benefit.
Exactly. It points to needing richer, perhaps more nuanced data beyond just PROM scores to get really accurate predictions, especially for something like satisfaction.
And this whole area of predictive power, especially around risk, it brings up quite a significant ethical point that was raised in the sources, doesn't it?
Yes, it absolutely does. It's a critical consideration. I mean, while risk stratification is helpful for tailoring care and allocating resources effectively, using predictive models to label patients based on their predicted outcomes or complication risk carries a real potential for marginalization.
Yeah, so.
Well, there's a genuine concern that patients who are deemed too high risk by an algorithm might be perhaps unfairly labeled as inoperable, even if they might still stand to benefit significantly from surgery.
So the algorithm could effectively deny them care.
That's the fear. It raises very challenging questions about equitable access to care and what role algorithms should play in fundamental clinical decisions. It's a complex ethical landscape we need to navigate very carefully as these tools get more sophisticated.
Definitely something to watch. Okay, beyond the predictive AI side, what other digital tools are factoring into the treatment and monitoring phases?
Well, robotic-assisted surgery is obviously a key technology that's integrated into treatment itself. It's often highlighted for enhancing precision in certain procedures, particularly mentioned in spinal surgery examples in the sources.
Right, the robots.
And then, increasingly, remote monitoring tools are becoming important, especially post-operatively. So things like wearables, external sensors, and even the development of so-called smart implants.
Smart implants, that sounds very futuristic. What sort of data are they actually providing?
Well, they're becoming much more of a reality. The digitalization review we looked at mentions smart implants being explored in areas like total knee replacements or for monitoring how well spinal fusion is healing. The idea is they can provide real-time data on things like the biomechanical load actually being placed on the implant.
Inside the body.
Inside the body, yes.
Yeah.
Or the status of bone healing around it, potentially even detecting early signs of the implant loosening or maybe the formation of infection biofilms. Really granular data.
Fascinating. And what about the more familiar things like wearables or external sensors?
Yeah, they're being used quite a bit to track patient activity levels, their gait patterns, range of motion during recovery. Wearables have actually been validated for accurately monitoring these sorts of parameters post-operatively for things like knee and shoulder surgeries.
And the main benefit there is?
The major benefit is enabling effective remote recovery monitoring. It allows clinicians to potentially tailor rehab plans based on real data and maybe identify complications earlier without needing so many frequent in-person appointments.
Right. Convenience and potentially better oversight.
That's the goal.
Okay. So all of this, you've got imaging data, clinical notes, sensor data from wearables, patient reports like PROMs, maybe even data streaming from a smart implant. That generates just an immense amount of information, doesn't it?
Right.
How do orthopedic systems even begin to make sense of that kind of fire hose of data?
That is precisely the major hurdle we touched on earlier. Data integration. It's huge. And as the Digital Twins TED Talk highlighted, data from complex systems, like a human body undergoing recovery, is often, well, sparse in some ways, noisy in others, sometimes indirect, and it often only gives you a snapshot of now. It doesn't automatically tell you what's going to happen next or why something is happening.
So just having more data isn't necessarily the answer on its own.
Not necessarily, no.
Yeah.
And this is where the concept of a digital twin comes in as a potential, maybe future direction.
A digital twin. Explain that a bit more.
Okay, so the idea is combining predictive models. These could be models based on physics, like how joints biomechanically move, or models learned from data using AI, combining those models with something called data assimilation.
Data assimilation.
Yeah, it basically means continuously feeding that model new real-time data from the actual patient. So sensor data, maybe PROMs they submit, perhaps even aspects of their lifestyle tracked via an app. You feed that data in constantly.
To keep the model updated.
Exactly, to keep the digital model of that specific patient, or maybe their implant, dynamic and current, and reflective of their reality.
So you're building a constantly updating digital replica of the patient's orthopedic situation.
That's a good way to put it, yes. Applying this concept in orthopedics could, potentially, create a really comprehensive, integrated digital representation of the patient. It could give clinicians a much deeper, more dynamic understanding than static records usually allow.
Leading to better predictions and more informed decisions, presumably.
That's the hope. But, and it's a big but, making this work requires establishing reliable, connected clinical databases, the whole big data infrastructure.
Right.
And it needs pretty unprecedented collaboration across different disciplines. You need the clinicians, the data scientists, legal experts for privacy and security, and crucially, you need the patients involved too.
And that brings us right back to the patient, doesn't it? Many of these tools, especially the monitoring apps, the data collection devices, they require the patient to actively participate. And we know getting people to consistently use healthcare apps can be a real challenge.
It really, really can be. And this is where maybe insights from completely different areas, like the Duolingo TED Talk, become relevant.
The language learning app, how's that relevant?
Well, the core idea discussed there is about applying psychological techniques that consumer tech uses very effectively. Things like gamification, smart notifications, visual progress trackers.
Making it engaging.
Exactly. Not to make healthcare addictive like social media, obviously,
Yeah.
but to make using the necessary tools, tracking your rehab exercises, reporting your pain levels, allowing sensors to collect data to make doing those things consistently more engaging, maybe even rewarding.
Sort of making the broccoli taste like dessert, as the speaker put it. Making the healthy, necessary thing feel a bit more appealing.
Precisely that analogy. For orthopedics, it means thinking hard about designing apps or integrating wearables in a way that genuinely encourages patients to stick with it, to track their progress, report how they're feeling, allow the data collection. Because the best remote monitoring tech in the world is useless if the patient stops using it after a week.
Patient buy-in and continued engagement is absolutely essential for the data flow these advanced systems need.
Couldn't agree more. It's critical.
So let's try and synthesize where we stand then, according to these sources. The potential for digital tech and AI in orthopedics looks, well, immense. It seems to cover the entire patient journey, right from that first contact all the way through recovery.
I think that's right. There's clearly significant promise for improving efficiency, for personalizing treatment pathways, enhancing safety protocols, and potentially improving patient outcomes, especially facing that rising demand we talked about.
But it feels like a significant, but running through the sources, many of these applications are still very much in development, or maybe in the early stages of validation.
Yes, absolutely. Widespread, routine adoption requires more robust clinical evidence for many applications. It needs standardized data protocols. We need to overcome those significant data integration challenges. We need to build trust. And very importantly, navigate those ethical considerations carefully to ensure fair and equitable access and application.
Lots of potential, lots of work still to do. Okay, Fascinating insights. Let's finish off with our lightning round quick questions, sharp answers if you can. Based on these sources, what's the single piece of digital tech that orthopedic professionals should really be paying closest attention to in the next, say, 1 to 2 years?
I'd say prediction models, specifically models that move beyond using just one type of data and start integrating clinical information, imaging data, and potentially sensor data together for more holistic prediction.
Okay, integrated prediction models. Beyond the technology itself, what's the biggest non-technical challenge to successful adoption of all these tools?
For me, it has to be establishing that robust, secure, and genuinely integrated data infrastructure across different parts of the healthcare system. It underpins everything else.
The data infrastructure. Got it. And finally, what's one small, maybe actionable step an orthopedic professional listening could take today, based on what we've discussed?
I think a useful step would be to actively explore the current state of data collection and accessibility within their own clinical environment. Just understand what data exists, how accessible it is, and identify potential opportunities for maybe better integration or better utilization of the data sources they already have.
Start by understanding your own data landscape. Excellent. Okay, let's quickly recap the key takeaways from this deep dive for you.
Good idea.
First, digital technology, especially AI, it isn't just a nice to have anymore. The sources really frame it as becoming essential if we're going to manage the growing global demand in orthopedics.
Unavoidable, really.
Second, AI is showing practical promise right across that patient journey, improving image analysis, helping plan surgeries more precisely, and getting better at predicting patient outcomes and risks.
Yes, definite progress there.
Third, while digital tools offer some screening potential, they currently have clear limitations for standalone remote diagnosis. That highlights the absolute need to integrate multiple data sources, the exam findings, labs, imaging, sensor data, not just rely on one isolated piece.
Crucial point, that integration.
Fourth, making all this actually work in practice requires building robust, secure data infrastructure. And we have to tackle significant non-technical hurdles like data integration itself, validation, building trust, and ensuring equitable access for all patients.
Big challenges, but necessary ones.
And finally, for those tools that need active patient participation, the apps, the wearables, we really need to think about how to genuinely engage users. Maybe borrowing successful techniques from other digital fields is key if these tools are going to deliver their full value.
Engagement is key, definitely.
If you found this deep dive valuable, please do take a moment to rate and share it. It really helps other professionals like you discover these insights.
Please do.
And as you reflect on the future of orthopedic care and the increasing power of these digital tools, here's maybe something to ponder. If AI gets really good at predicting a patient's likelihood of satisfaction or their risk of specific complications, how does that fundamentally change the nature of the conversation, that shared decision-making process that happens between the doctor and the patient in the clinic room? What does that look like?